This is a panel discussion unlike anything you've ever experienced. Here's how it works. Pecha Kucha, it's a presentation style in which 20 slides autoplay for 20 seconds each, and these folks don't control their slides.
My belief in the model of co-production of care, experience, and wellness, and the importance of people, connection, and community, a theme that I will call relationship-centered care. This is informed by my own experience to healthcare as a provider and as a consumer. It's quite ironic how the stars aligned where my professional and personal life focus collided when my wife started having some GI symptoms that got progressively worse. Her symptoms and labs with an ESR of 120 were brushed aside as something that women tend to have, and let's just follow the trend. She ultimately got diagnosed with Crohn's disease. That was my first, but unfortunately not the last experience of recognizing the challenges being on the other side of the healthcare equation and the need for deep listening to patients and families. Another recent reminder of this lived experience was when I was traveling internationally and had to navigate the boarding process in an unfamiliar European layover with poor signage and less than helpful directions. Actually happened here as well when I was trying to find a ride share and there was no clear signage. We ultimately made it with few minutes to spare, but the most I could have lost was a connecting flight. That feeling of near panic and loss of control reminds me of the healthcare setting where it seems that we deliberately create facilities without clear signage and human support for families who are figuring out parking directions and oftentimes billing queries with a sick loved one in tow or on a wheelchair. Every day, they trust us with their most precious asset and the most vulnerable time. My feeling of helplessness is akin to what families feel in healthcare settings. I mean, we can improve every single step of this journey to deliver exceptional experience, an experience that I will call an expectation of unreasonable hospitality, which means this is a level of service that is above and beyond. A wow factor by giving people more than what they can expect. It's about connection and graciousness. To deliver this unreasonable hospitality, I referred back to the expertise of my patients and families and asked them what it meant for them. They told me that the perception that the healthcare provider sees them as individuals and as humans rather than a diseased condition, and developing a trusting relationship over time with positive experiences, mutual respect for each person's perspective and continuity of care. Reflecting on this feedback, it is clear to me that a culture of hospitality means to be heard and to be valued, a sense of belonging. Amid the sea changes and disruptions in healthcare, the human connection, people focus, relationship-centered care remains at the core of any enterprise that aims not only to survive, but thrive in the emerging environment. The move towards digital-first care, self-service, and biomonitoring underscores a shift towards autonomy in healthcare management, driving systems to prioritize digital engagement and invest in technologies that support a more intuitive patient experience. To meet the evolving demands of the healthcare consumer, health systems must prioritize around-the-clock availability and accessibility and convenience, moving beyond the traditional store hours model by offering 24/7 access. This constant connectivity means that the health system should need to create work streams and work teams who are leveraged to be available to answer these 24/7 connections. And by leveraging all these enablers, we have the potential to integrate medical history with data sources like genomics, lifestyle choices, preferences, and social drivers of health in conjunction with patient-generated data from devices and wearables. This data-rich and foundation is crucial for healthcare providers to deliver proactive, predictive experiences that are attuned to both cultural nuances and individual health needs. This hyper-personalization and digitized patient profiles can then enable the care team to foresee health challenges, devise tailored intervention strategies, and personalized communication and treatment plans. Imagine a bi-directional, fully digital concierge, a responsive, interactive platform where patients can ask any questions, receive responses that are curated to their specific needs, and guide them through treatment pathways, including billing queries. It could provide personalized support and seamless continuity of care. If airlines have been able to figure this out, even the car dealerships, so can we in healthcare. Orchestrating seamless experiences represents a shift towards a healthcare system that actively works to anticipate patient needs, offering solutions that are both timely and contextually relevant, ultimately leading to improved patient satisfaction. People will forget what you do, what you said, but will never forget how you made them feel. There is still a gap in the feelings of trust between consumers and health systems. And without the trust, we cannot deliver an exceptional experience that engenders engagement, adherence, and enhanced outcomes. Reflecting back on the feedback from my patients, we can build this trust by being team-oriented, flattened hierarchy, transparency, and easy navigability. So my hope for an exceptional experience, which oftentimes starts before the visit and may only end when the final bill drops, is to create a win-win situation. What I need when I need it. It is important to keep that in mind. In the next slide that you will see, there is this sunrise over Lake Louise in Banff. This reflects a new dawn of exceptional patient experience where a transformative experience is relational and not transactional, where we all are patient experience. You will see a truck driving in the next slide. I saw this a couple of days ago, and the name of the company very resonated with me, which is the Perfection Group. I believe when we can easily transpose what they want to do into an HVAC company into a healthcare setting. We are building a better future, one person and one patient at a time by working together. We should remain curious and not judgmental. I will end by sharing that we are stronger than we think, less alone than we imagine. We are all the answers to each other's questions, and we come here together to love and learn to live together. Human connection, memorable experiences, excellence, and hospitality, these are the cornerstones of exceptional patient experience. Thank you.